Around the world, many countries have implemented some kind of universal or near-universal health coverage. In OECD countries with available data, at least 90% of the population is covered under public or private insurance. But universal coverage is only one piece of a complicated healthcare puzzle. The Commonwealth Fund, an American foundation that provides annual performance rankings of health systems across the OECD, rates countries on their access to care, largely determined by affordability, the care process, things like how safe it is and the quality of doctor-patient relationships, administrative efficiency, the level of equity across income groups, and health outcomes for patients. 3 countries with very different systems are the US, the UK and Switzerland. The US spends about twice as much on healthcare as other OECD countries as a percentage of GDP. But that spending doesn't translate into affordability. It's the only high-income country in the world without universal coverage. About 58% of the population has private health insurance, but more than 8% has none at all.
This legislation will not fix everything that ails our healthcare system, but it moves us decisively in the right direction.
Since the introduction of the Affordable Care Act in 2010, access has improved. 20 million more Americans are insured, but medical bills remain the leading cause of personal bankruptcy. Many insurance plans are tied to employment packages, so if a worker loses their job, their cover goes too. The UK's so-called socialised medicine provides universal health care through its National Health Service, which is publicly funded through tax revenue. Private insurance is available, but uncommon. The NHS was a key issue in the Brexit campaign.
We're going to protect it from the people like Michael, Nigel and Boris.
We can take back control and spend on our priorities here in this country, including on the National Health Service.
Brits are very proud of their NHS. A 2016 survey of what made them most proud to be British saw it take out the top spot, well ahead of the monarchy. The Commonwealth Fund ranks the UK as the top performer overall, but the UK lags behind in one crucial area: health outcomes. Cancer survival rates and child mortality rates, for instance, are lower than its OECD counterparts. Switzerland is an example of a universal and entirely privatised system in action. There are no free health services provided by the state. Instead, healthcare is delivered through a competitive, heavily regulated private system, and private insurance is compulsory. Nearly a third of the population has their premium offset by government subsidies, which are pegged to income. Despite that, the Swiss system is also one of the least affordable. 46% of people reported out-of-pocket medical bills of more than $1,000 in 2016. If universal, affordable, quality healthcare is the goal, there's room to improve across the board. And in places like Australia, with an ageing population and increasing rates of chronic disease, even a system that strikes the right balance needs to be flexible enough to adapt to shifting burdens over time.